Hello. Hey guys. I see a few of you joining in. It's my first time setting up, so hello Medico Nature. How are you guys? Just post in the chat. I've got both chats running. So if you're following us on Instagram or on YouTube or Twitter, hopefully I'll be able to see you guys. Hello, another aspiring medic. It is. I actually saw that apparently there's going to be a bit of a kind of meteor show. I'm not sure if that's true. Last time I heard that, I went outside. Was pretty disappointed, to be honest. But I do live in London, so it is a bit cloudy and polluted, unfortunately. So, guys, I hope you're all well. There's a few of you guys now, so don't want to keep you guys waiting. Thanks for joining us. So my name's Abdurrahman. I'm a fifth year medical student at University College London, UCL. So you guys will be familiar with Tafsir. Tafsir is an excellent host for you guys. He's usually with you guys every week. And he's pretty much an expert on the matter of applications. He basically runs the UCL outreach program, or helps run it at least. And he's also a interviewer for UCL. He's in the year above me, so he's actually not able to join us today because he's doing what is the SJT. Some of you guys will be familiar with an SJT because of the UCAP, but he's sitting that next week, so it's pretty important. It's basically going to be about 50% of what decides on which place he gets to go to, in terms of what hospitals he goes to next year in terms of his selection. So it's a pretty big exam for him, 50%. So he's taking this week off. So I'll be joining you. I'm the co-founder. I'm the co-founder of Medmentor, and hopefully I'll be able to answer your questions today. It's just my brother in the corner. Let him get away with that. So if you've got any questions, do send them in. It can really be, so we're at December now, aren't we? So there's hello Daniel Bozan. We're in December, so there might not be a lot going on now. Some of you guys might have sat some of your interviews in year 13. Some of you guys might be still waiting. Perhaps you've got it in the next week or two before the Christmas holidays. Others of you might still be waiting, and I'm more than happy to answer questions across the board about all of these topics. So do send your questions in whenever. Even if you're in year 12, I'm happy to answer any questions as well about what you should be thinking about. Perhaps if you've got any kind of concerns, especially with COVID, in terms of what you've been told you need, but you might not have had the chance to get because of opportunities being limited now with going to hospitals, for example, and work experience. I'm more than happy to answer these questions, or just general questions about medicine and what it's like to be a medical student. It's pretty fun. I'm enjoying clinics. So happy to answer that. Happy to tell you about what pre-clin, sorry. So the more sciencey lecture-based years are like compared to clinical years, because that is a big chunk of what you do at medical school. And at least at UCL in traditional courses, and that is a big consideration actually in hindsight. I think that it does make a big deal to how much you enjoy the course, whether you decide to go to a course that you essentially go to a course that has 3 years of basically just science, and then one that has clinics. So we've got our first question. What unis did you apply to and how many offers did you get? So I applied to Imperial, UCL, and Imperial, UCL, St. George's, and Barts, so all London, as you can see. And I got 3 offers, 3 out of 4, yeah. My brother, who's also a medical student, he applied to UCL Imperial. He might join us in future talks. He's also on the team, and he applied for Imperial, UCL, King's, and Barts, and he got 4 out of 4, so 1 up from me. Oh, hi Daniel. That's pretty cool. Glad you've discovered us in the UK. Yeah, so I hope you answered your question, Ahmed. If you're interested in finding out more about kind of what specific universities and what they're like, I can tell you. Obviously, I'm at UCL, but I do have friends at other universities, and I can hopefully give you guys a bit of insight into what the different universities like. Probably better. I'm better qualified to answer questions about London unis, to be honest, than outside of London, maybe Oxbridge as well. One of our co-founders also offers there. So yeah, but yeah, so clinics is quite interesting. Feel free to send in questions, but I'll just talk about clinics. If no one really wants to ask questions, just wants to hear me talk. Clinics have been interesting with COVID. Definitely something that I was concerned about, not being able to essentially do much. I thought we would just be a lot of things would be online, and that's quite concerning as someone who's only doing 2 to 3 years of clinical years at UCL, because the first 3 years are just basically doing lectures. So if you're suddenly missing half of your clinical kind of exposure, that is quite concerning. And so a lot of us were worried about not basically COVID impacting our studies, and we were worried about being qualified doctors. But actually what I found is that I've had a really good experience, at least at UCL. I found that we've actually got loads of exposure, more than I thought we would. If anything, I think some of the placements have been even better than before coronavirus. They're treating us more like part of the team as opposed to just students who are just visiting. We don't get as much variation, but we do stick to one team, and we basically feel quite integral. Okay, so we've got a question. Do you guys have to take an exit exam after the graduation from med school? So I'm not sure what you exactly mean by exit exam, but basically in the United Kingdom, we do have to we have a like final year's exam. Essentially, it's the exam that decides of whether you are it's basically a pass fail exam. So it decides on whether you're good enough to be like you meet the minimum standards to be a doctor, to be a safe doctor. There's no like rankings or anything. It's just to see if you fit, if you're good enough, essentially. Once you do that, you go into what we call the foundation years. So there's 2 foundation years 1, foundation years 2, and in foundation years in the foundation years 1 and 2, you don't sit exams, but after the first one, you automatically become fully qualified. So when you finish your medical school, you're actually not a fully qualified doctor. You're partially qualified. You're like partially registered with the GMC, which is the kind of the body that registers doctors. It's after the first year of foundation that you actually become fully qualified. So a lot of people actually who want to take a break from medicine, or even leave medicine, or just to explore other things before they come back to medicine, they tend to wait after the first and second year of foundation years. You rarely see anyone who takes a break after finishing medical school before they start work, because they're not actually qualified. So a lot of people do wait until after. What do you think of the UKMLE? Do you think it will make more difficult for international grads getting into the NHS? So I'm not actually too familiar with the UKMLE. It sounds like a new standardized exam. I know that they were thinking about trialing that with us. I'm not sure if this is the UKMLE, but I know that they were thinking. So at the moment, the way it works is that every university, every medical school has to examine their students to ensure that they meet a basic level of quality, essentially a basic level, a minimum required competence level, basically, to see that they're safe enough and good enough to be a doctor. However, this is every medical school kind of sets it on their own terms. So as you can imagine, it might be slightly different at some universities compared to others. In the future, what they do want to do is create a standardized exam. So there's one exam, everyone in the country sits the same exam at the same time, and then that's kind of sets the tone. There are lots of pros and cons to it. I won't go into detail here because it's quite far down the line for a lot of you guys who are joining us. But essentially, that's something that might come into place. Okay, there's quite a few more questions. What's the best way to prepare for MMI interview? To be honest with you, MMI interview, there aren't that many different sorts of stations they can include. So I think, well, first of all, it depends. I think divide your interview preparation into two, I would say. Interview prep can be divided into, so before you get an offer and after you get an offer. Before you get an offer, it's best to kind of keep it general and keep your revision, essentially general, and don't focus down on any one university because you have no idea, unless you have a general idea of when you might get interview offers, when that university sends out offers. I wouldn't kind of just put all your eggs in one basket. So what I would do is, for MMI specifically, I would kind of write a list of all the different sorts of stations that you could get. So for example, one classic station is the sort of acting station where they kind of pretend you're in a scenario where you've done something wrong, you've made a mistake. So actually in my St. George's interview, one example, I'm not sure if I'm allowed to say this, but essentially, I won't go into detail, but they essentially ask you, they put you in a situation where you've made a mistake, like a bad mistake, and you work in like a shop or a retail place, and the patient comes in, or rather the customer comes in, they're very, very angry, and you're essentially tasked with trying to calm the situation down, trying to handle it. And actually, what they're trying really to find out from you when they're doing that isn't how good you are at sorting out customer service issues at a shop. They're really interested in figuring out what is the equivalent scenario in medicine, which is a very angry patient or a very angry family member who walks into your clinic or walks into the ward or is visiting a relative, and they're very angry about their care, and they want to see how well you are at de-escalating the situation, at basically diffusing the situation so it doesn't exaggerate, doesn't kind of take off. Or sometimes it's the patient themselves. If it's, for example, a psychiatric patient, one of the key things that you need to be able to do, at least in your first step, is to verbally de-escalate. So you don't start to go and give the drugs that help calm down patients straight away. You try to talk to the patient, you try to break things down a bit, and then if that doesn't work, then you go on to later steps. So in the MMI interview, that's one. I went on a bit of a tangent, but that's one of the stations. So what I would really get good at, and it's very difficult to predict a specific scenario that they'll give you, but what you can do is like look up a lot of those scenarios and get really good at improvising. And once you've done a few of those scenarios, they actually don't differ that much. So even if you do get one that's slightly different in the future, you'll be pretty good at knowing what to do. For example, the one thing I would do is search up how to break bad news, for example, because I think that that's actually something that you'll use. For example, offering them a drink, getting them to sit down and talk to you, sitting down, because someone who's standing up versus someone who's sitting down makes a big difference. Offering them something, kind of giving, like saying things in small chunks rather than just blurting everything out, being super empathetic, understanding where they're coming from, trying to help resolve things, like listening a lot, active listening as well, not just like sitting there and not listening to them, actively responding to their concerns, that sort of thing. Those are the sort of things you actually find they are literally copy paste the sorts of things someone in retail, someone in customer service would need to do, and someone who is in medicine will need to be able to do as well. So actually, a lot of these things are not just that, like, for fun. They're actually trying to see what your personality is like, and actually will say a lot about how you can handle situations. In terms of other sorts of MMI preparations, I think that, yeah, like I say, so there's the other classic stations that you need to be able to go through. So there's always that classic personal statement station. So knowing your personal statement inside out, because they might just go in and ask you about different things. So being able to expand on any single point in your personal statement. So the best way to do that is print off your personal statement, highlight different parts of it, and thinking of answers. And in general, when you're preparing for interviews, you never ever write things out in full, like kind of full sentences, and try and learn them off by heart. One thing that interviewers often do look out for is how robotic you sound. If you sound rehearsed, that's a real red flag for them. So the one thing you do want to make sure that you do is write bullet points. So you do want to be able, because you don't want to, there's a balance, right? When you're asked a question in an interview, you don't want to be sat there thinking and having no idea what to say, right? Sometimes they ask a difficult question, that is okay. But if they're asking a relatively normal question, you don't want to sit there and sound stupid or sound like you don't have anything to say. At the same time, you don't want to suddenly come into a robotic response and automatically say something that you've learned off by heart word for word. So the best way to get around that is to write bullet points for all your for all the questions that you're preparing for. So why medicine? When you're thinking why medicine is a classic question you always get asked. The why this university is another classic question you ask. Those are usually bundled into a station at medical school interviews, MMIs, and panels actually. So having bullet points of what you want to say, or the general ideas of what you want to say, is a really good way, and flashcards or that sort of thing is very good. And then essentially what happens is every time you answer the question, you don't answer it exactly the same. So it doesn't sound fully rehearsed, but you do have the kind of points straight away off the top of your head, and that does make a big difference. It makes you sound smooth, makes you sound good, but it doesn't make you sound automated and robotic. And so that's a really good way of preparing in general. Yeah, so the sorts of stations are personal statement station, the acting station, which is trying to see like your empathy and personality, work experience stations. It's been a long time since I've done this. The why medicine and why this university question. So that's a really good one. Preparing for your interviews, you do need to know a little bit about that university or medical school. So finding things out. So one thing that I found really interesting in one of the videos, YouTube videos, is right. So when you're picking a medical school, the classic answer to say, if someone says, why choose, let's say UCL, is to go into like nitty, like people want to like impress the interviewers. So you naturally, you research and you try and find very specific details about UCL and say, oh, UCL is the place where X scientists discovered X thing, and I think that's incredible, and that's why I joined UCL. That's a ridiculous answer, okay? Because no one really picks the universities based on that, and that actually comes across as quite disingenuous. So the admissions tutor who was talking on this video was essentially saying something that would sound way more impressive, and not necessarily impressive, but way more genuine. And being genuine is actually a real big key skill when it comes to medical school interviews, rather than just knowing information. Coming across as genuine is a big tick box for them. Is to be able to say, actually, the reason I picked this university is because I like London, I like the area. I've always wanted to live here. I've always wanted to be able to discover these sorts of areas, etc., etc. That actually comes across much better than saying that X scientist in 50 or 100 or 150 years ago discovered this gene, and that's why I'm so impressed and I want to join. Because yeah, it just doesn't, it's not really honest. So being honest, being open and honest is something that actually an Imperial admissions tutor said to me is a key skill or a key part of the interview, rather than knowing, like, being able to answer super scientific questions or anything like that. Anyway, sorry, I've neglected some of the questions. So the kind of standard exams that I was talking about earlier is going to be apparently rolled out in the year below me, so in 2023. So you guys will be affected by that. I have an MMI, so this is from AA11723. I have an MMI interview in January. The acting station requires myself to be a COVID volunteer. Oh, they've told you what's going to happen. That's interesting. The acting station requires myself to be a COVID volunteer, speaking to an actor who has been shielding isolated. How should I tackle this station? So it'd be good to understand what exactly they want you to be able to talk about. Is it why they're shielding? Are they asking you to explain the shielding measures and why they're important? I assume it is, but it'd be good if you let me know so I can answer that as best as possible. Oh, hi, Tafsir. I'm going to answer that just in case, so I don't forget it. So yeah, essentially the best way to tackle that sort of question, it's again, there are always parallels between the kind of questions they're asking you guys and the kind of things that you end up being as a doctor. So kind of things you'd end up doing as a doctor. So knowing those kind of stations lets you actually research those online, and actually you can pull up lots of parallels on how you deal it. So this is the classic kind of station that we would get at medical school, where they would ask us something like, this patient is coming and asking about vaccinations. They want to know why they need to get vaccinated. Could you speak to them? And this is a similar thing, I imagine, on where you have to explain to the patient why they need to be shielded, why they need to stay isolated. And the key thing is, so it's all about communication here. It's very little about what you actually say in terms of the content. It's much more about being able to simply come across and explain things well. And the best way to get about that is to really break things down into pieces, and just being very, very clear and being empathetic. Again, empathy. So the real core values are things that they will always test you on. And actually, there's a document. If you check out the Super Hub, there's a document with all the different values they want you guys to have as doctors, and they are testing for this when they're doing interviews. And things, the real big ones are like being a good leader, being a good team member, being good at empathizing, being good at communicating, that sort of thing. And the thing they're testing here, I think, is communication and empathy. So communication just comes from how well you're able to say things in very simple terms. You're not using jargon. You're not talking at a very, very scientific level. You're talking to a member of the public. So you need to be able to avoid that. If you fall into that trap, then that's going to affect you. The other thing you want to do is make sure you empathize with this patient. Someone who has to stay indoors for a long period of time and is not able to meet family, friends, and go out and do the things that they like is going to have a big impact on them. And you being able to recognize that and saying, I know it's a very difficult time for you. I know that it's going to be tough to stay indoors. However, hopefully this is for your safety. This is for everyone else's safety as well. We want to make sure that everyone's able to make sure everyone's in the best health and avoiding a scenario where you might contract COVID-19. And we know from the evidence that someone at your age range who contracts COVID-19 unfortunately doesn't have a great outcome. And using the classic thing is to use the line of like, the evidence shows us. We're often taught to say that because it's a good way of kind of bringing patients on board. It's also really, really good to make sure that you actually still acknowledging them and you're not kind of having this kind of defensive back and forth like argument. It's like very much like, I know it's difficult, but these are the reasons why, and being very, very open about it. I think that's the best way, and I hope that answers your question. Okay, what uni is this question for? I'll leave you to answer that. How important is a resume CV when applying in top-notch hospitals? What do they expect from fresh medical graduates? To be honest, Danielle, you're asking a lot of questions that I'm happy to answer, but I might not be the best qualified person to answer them, since I'm still a medical. However, it depends on the speciality you're applying to. It really depends on whether you're applying to a London hospital or a hospital outside of London. you said that you were an international, so it might be a bit different in terms of how you get into it. It might depend on your kind of exams, the UK board exams that you might have to do that we might not need to do as UK graduates. So to be honest with you, I think it's best maybe to look that up online and maybe go in and send emails and ask. Yeah. How do you go about starting up an organization like Medmentor while still being a medical student? Well, with a lot of discipline and, to be honest with you, a lot of catching up. Yeah. They are trying to see my not that I'm actually able to do that as well as I wish I could. They are trying to see my communication skills in the acting station, show empathy. I need to ask about the actor's well-being. Yes, exactly. And what services the volunteer can offer. Any tips? Yes. Okay, perfect. So there's quite a few services now. So there are like talking services where patients can call a number. I can't actually remember the name. It might be Age UK who's doing this service. But essentially, you can actually sign up as a volunteer for these, and essentially you could speak to the you can offer for the patient if they, because loneliness is a really big part of people who are shielding. It's one of the kind of biggest problems of asking people to shield is loneliness and that impact on mental health, and it's actually significant. It's not a small thing. Doctors are noticing these problems, and they are having a real change in numbers. So offering them or letting them know about these sorts of services, like that they can call this number from Age UK, and be able to speak to someone at any time if they're feeling low in mood or whatever. That's always available to them. There's also the services of people who are helping out in local communities that can go and buy and pick up things for different people, and essentially get things from the local shop, etc. So there's that sort of service. And I think, just thinking now, actually, off the top of my head, one thing that might be quite impressive to say is asking about their mood. So one thing that we often get is basically it's a depression screen. So this is quite advanced, but it might sound quite impressive. Is essentially we always ask, or we try to ask, two questions if we ever suspect someone might be depressed. And this is definitely, people who are in the shielding group are generally older. People who are generally older in that age range do have a higher rate of depression, particularly if they're needing to shield. So asking these two questions, the first one is, do you feel low in mood? Or do you feel low in mood? The second thing is, have you stopped enjoying things that you used to enjoy? So these are two questions that we always ask. If they say no to both questions, then you kind of just move on. But if they say yes to either question, that actually could indicate that this patient could be depressed. And if they are potentially depressed, then you want to refer them to services like Mind. You want to refer them to maybe basically for a consultation with the GP. Since you're a volunteer, so you're not medically qualified, you'd want to refer them to speak to their GP about that. That sort of thing. So asking them if they're kind of this is within the whole well-being thing. Asking them about that might be a great way of kind of impressing the examiner, and also kind of recognizing that depression is something that you should be aware of and looking out for. Anxiety is another one, but I think that's less relevant. But we do. So I'm in my GP placements, and some patients they basically order COVID tests every few days, very, very, very regularly, and that is a very strong sign that this patient is suffering from sort of big anxiety from COVID. But if someone's staying indoors all the time, I don't think they'd be as anxious. They might be anxious about going outdoors though. So yeah, I hope that helps. If you guys have any more questions, send them through. Whether you're on Instagram, YouTube, Twitter, I'll be able to see your questions. Even if you're in year 12, there's plenty of things to be thinking about. So feel free to message. Cool. Yeah, I think there's also another set of questions. That's right. There's also another set of questions that we ask people if we're worried about anxiety. You can look it up. It's called GAD, General Anxiety Disorder. So if you just search it up, you can find questionnaires that might help you with that as well. Do you have any? So we have another question. Thanks. Do you have any tips for the "What's a weakness you have" question at interview? Okay. That's a good question. That's always the ones that are supposed to like sort of catch you out a bit. So obviously the natural thing is to think of something that. So be honest, be open and honest. That's a very good question. Be open and honest. Sometimes it's a bit obvious if you're trying to like say, oh, my weakness is that I always want to get 100%. Like, don't do that. Just really don't do that. That just sounds really bad, and it just kind of makes everyone roll their eyes. I think, yeah, be like genuine. I think don't say something that is like a red flag for them. So don't be like, I have anger issues, or something like that. I mean, I don't know if you consider that's a weakness. I guess it is a weakness. But yeah, so you don't want to say something like that, but you also don't want to say something that's so tiny that you're like, okay, is that really your biggest weakness? So I think like something along the lines of, sometimes I find it very difficult um, I think a very reasonable thing that maybe I would say even now is I find it difficult to focus, or to be to avoid procrastination. I think that's a weakness of mine personally. I think the real tip actually, in terms of, because everyone's going to have a different kind of weakness. The real tip here is to quickly follow up your weakness with a solution. So they don't mind. The reason they're asking that question is because they want to see you, how good you are at coping. So they don't mind if you say, I have a weakness in something, as long as it's not a really bad thing, as long as you quickly say how you're handling it. So for example, I'm really bad. I procrastinate a lot. For example, I find it really hard to focus on something. I always end up opening up YouTube and watching lots of videos. But I've been able to manage that over the last few months by using a combination of blocking, like the apps that block your phone, and block any kind of websites, and also using a technique called the Pomodoro technique, which is that you spend 55 minutes working and then you can spend 5 minutes doing whatever you like, sort of thing. So the real trick here is to be able to say that you are able to manage it. You are able to recognize that you have a limitation. That's the number one thing. And that is why if you're not able to say something that is reasonable, because everyone has weaknesses, that comes across as disingenuous. So that's the number one thing. They want you to be able to self-reflect and really be honest with yourself. And then the number two thing, so that's the idea of being able to recognize your limitations. That's word for word what will be written in the GMC guidelines. And the second thing that they want you to be able to do is quickly follow that up and say how you've been able to overcome that, how you've been able to manage that. So I hope that helps. No worries at all. Another question is, how do jobs in primary care complement each other? Okay, that's quite an interesting question to ask at an interview, medical school interview. So I think the real key thing to remember here, because fortunately I've just started my GP placement for a week, so I do have a bit of insight into this. I think that understanding that a GP actually is a very tight-knit team, a very tight-knit group of people who are working very, very closely together to help care for their patients, and that actually there is tons of overlap between what they do and how they help their patients. For example, if a healthcare assistant is helping kind of replace someone's kind of dressing, they've had a surgery recently. So one patient who had a surgery for a pacemaker, and they replaced the dressing, but there was quite a lot of blood that was coming out when the healthcare assistant was replacing that So she became quite concerned because that's not supposed to happen. It was a week since, so the wound should have been completely healed up by then. So she went in and called the doctor. Doctor came and helped out. So there is very much this kind of working together aspect to it. I'm not sure if that's actually a very good answer, to be honest with you. It's a question that I'd have to think about. How do jobs in primary care complement each other? Yeah, I'm not sure if that helps. Are there any issues that can arise with different jobs in primary care? Yeah, I mean that the example that I just gave you now would be an example of, like, sometimes I've heard some friends who've been at GP and a patient's been describing their symptoms, and the GP is like, this person's having a myocardial infarction, they're having a heart attack. So one of the really big things of the GP is GPs are known as gatekeepers very often. And one thing that they need to be really, really good at is sifting through the presentations, the symptoms that patients are presenting with. So they need to be able to recognize three things really and put them into three sorts of categories. They need to know is this patient doesn't really have anything much going on. They might just be a bit anxious about something, a bit concerned, and they just want to get some reassurance. There's that category of people, which is fine. That's a job that GPs need to do, and it's an important job. The other side of it is something what we call red flags. So GPs need to be able to say and know that if a patient presents with a certain kind of, there are certain things that a patient might say that might indicate that they have something that's more sinister and more dangerous, something that they might even need to call an ambulance to come to the GP surgery and take that patient. Of them is something like meningitis. If a patient has really bad headache, light is very irritating for them, they've got a fever, that sort of thing, then you're like concerned that this, and if they've just recently been traveling, you're concerned about meningitis. That's when you think about, this patient needs to go to hospital straight away. They can't go back home. I might need to call an ambulance. Same thing with heart attacks. If someone's got very painful chest, central crushing chest pain, and that someone's really worried about that, again, something that the GP needs to be really good at is knowing what's the difference between that and just really bad acid reflux, which the pain is not that far away actually on the chest. So a patient who might just think they've got acid reflux might actually be having a heart attack. So a GP really does need to be very, very good at essentially differentiating between these two things. And the issues can arise is when they miss these things. And unfortunately, that's where a lot of complaints and a lot of problems can arise. So I hope that helps. Do send in your questions, guys, if you have any more. Feel free to ask about the application, or it could just be about medical school or my experiences. No worries. I hope that helps. How do you feel about the UK? Okay. How do you feel about the UKFPO news, especially as you had a compulsory intercalation? Yes, actually, I think this is a really important topic for you guys to think about. So let me explain this a bit, because it does impact you guys when you're choosing your universities, and essentially when you're picking your offers and which ones you want to go with. So the UKFPO, so this is the organization that essentially decides where you go as a doctor once you've finished medical school. So they decide for you, basically, there's an application process that you have to go through, and depending on how you do in the application process, you might go to a hospital. It basically decides on whether you go to a hospital in London or wherever. So you rank your options, and depending on your performance, and the better you do, the more likely you are to get your top choice. Now, as part of that application, to be able to get points, because the more points you have, the more likely you are to get your top choice. As part of that application, they used to consider your intercalated BSc. So the BSc that we do in UCL at third year, they used to consider that, and they used to give you points for that. So if you got a first, you'd be given 4 points. If you got 2 1s, 3 points, 2 2s, 2 points, etc. So you'd get points for that, and that would actually make a pretty significant impact on your outcomes. The same thing with getting publications. If you got publications, so a lot of students, they do research in their free time, in their summer holidays, etc. If you had publications, you would be able to get points. Now, they've decided to scrap that completely. And from not my year, fortunately, I'm the last year that they're going to still consider these points. The year after me, so those who are graduating in 2023, these students and all of you guys who are applying to medical school right now, you will all you essentially won't have any sorts of points or perks for getting an extra degree, an intercalated BSc. So if you decide to apply to UCL, Imperial, Cambridge, Oxford, or the other universities, so these four are, it's compulsory to do an intercalated BSc. There's tons of other universities where it's an option. Barts, I think, is an option. St. George's option. All of the other places where it's optional. This basically means that if you do decide to choose somewhere like Imperial, UCL, Oxford, Cambridge, there might actually not be that much merit to having an intercalated degree. And that might impact your choice because a lot of people might pick a university. I don't think if it's a majority, but a lot of people might, just so that it helps them later on in their application, so that they can get a more competitive application. So now that's not the case. It's worth considering on whether you still want to go to a university that kind of forces you to do a degree like this. A lot of people that I've been speaking to in the past week or two since the announcement is a lot of people have basically kind of been put off by this and actually would say that they wouldn't have done a intercalated BSc if this was the case. So it should be something you guys consider. A lot of people are not really kind of wish it was optional now, and kind of wish that they didn't have that they didn't have to do it if they didn't want to. Obviously there are still students who want to do it. It's also had a really big impact on people who do something called the MB-PhD program, which is basically when you do a PhD halfway through your medical school degree. That's completely, basically, it doesn't really matter if you do that in terms of points. So yeah, it's I think it's bad news. I think it's going to impact people's interest in research. It's going to impact medical students. Just in complete honesty, medical students won't do things that don't help them with their applications at some point. So if it doesn't give them points, unless they're very, very interested in that thing, they're just not going to do it. And now it's just going to put people off doing research. And a lot of laboratories, a lot of research relies on medical students giving up some of their time to be able to help out in the lab, collecting data, analyzing data, etc. And essentially that just won't be the case anymore. People just won't do it. So yeah, it's not a good idea in my opinion. But I would say that as someone who goes to university, that kind of forces you to do it. So the chances that there is a chance that places like UCL, places like Imperial, Oxford and Cambridge, maybe less so Oxford and Cambridge, will no longer make it compulsory. So at the moment, medicine's a 5-year course, and then you do a 1 year in the middle of it for this intercalated BSc. There is a chance that places like UCL, Imperial, it's not confirmed or anything like that, may decide to make it optional. So if you want to do the extra year, then you can, and if you don't, you don't. But remember, this is an extra £9,000 that you're paying for a degree. You're also paying for living out. So in London, it's going to cost you around £20,000 every year to be able to go to university. An extra £20,000 for a degree that you don't really need unless you're going to suddenly leave medical school halfway through is not a great bargain. It's not great value for money. If you're thinking about it in that way. So whether you think it's, a lot of people would say it's a bad idea. I hope that answers your question. Let me just have a drink of water. What will be the effects of Brexit on the NHS and healthcare in general? That sounds like a very good EPQ question. So if you're thinking of EPQ questions and you're stuck for ideas, there's one for you. Well, it's a good question. I think the impact on supply chains will be a big part of that. So a lot of maybe drugs, basic medical equipment. A lot of medical equipment is like one-time use, so it's thrown out. So there's a big turnover of equipment. There always needs to be supplies coming in all the time. If those supplies are coming from mainland Europe, then ensuring there aren't any problems at the border will be a big factor in how much the NHS is impacted. To be honest with you, I think the bigger impact will be from. I think that there'll be like a much more second order and third order impacts, to be honest, on the NHS, in the sense that if the economy if there are problems with the economy, that will have further impacts on people. So higher unemployment, lower pay for people, that has an impact on people. There is a very strong correlation between people's like how much money they have and how healthy they are. The more money you have, the higher socioeconomic status you are, the more healthy you are. And it's why in certain postcodes people have much longer age expectancies than other postcodes. So there's that impact. If economy starts to turn for the worse because we've left the European Union, whether it does or doesn't, we don't know. That will have a very bad impact on people in terms of their health. It will also have an impact on tax revenue. So government, pretty much the only way that they get money is by taxing everyone. If people don't have money to pay taxes, the government has less money. If the government has less money, 11% of the budget, around 11%, is spent on the NHS. There's less money for the NHS. So very bluntly, it means less money for the NHS, and that's not a first order or second order. That's almost a third order impact on people's health. So yeah, it's very much worth. It's actually a very important topic, and a lot of medics don't necessarily get involved in that. I'm actually very interested in the Brexit situation. I follow politics a lot, so I do think personally, it's my personal view. I think it's a horrific idea that we're leaving the EU, but that's just me. Yeah, unfortunately that's there's going to be a lot of impact, at least now, especially when they're talking about no deal Brexit. But yeah, I think unfortunately not a lot of healthcare workers, maybe because it's just a matter of not having enough time, are very clued up, or maybe they just don't think that it will have much of an impact on them, whether we're in or outside of the EU. A lot of people, ironically, have a viewpoint that being outside of the EU means that we don't have to pay as much money to the EU, which means that money, the classic, I think 250 or whatever it was, £1 million a week, can all go towards the NHS now instead of the EU. Although now we've realised that's not true. All of that money can now go funnel to the EU, and as a result, that can essentially be used for the NHS, and that's obviously turned out to be a farce. So it's a bit unfortunate. I hadn't thought of the second and third order impacts, especially connecting with it. Yes, yeah, there's a lot, and I think if you're thinking, is this like an EPQ question? Are you writing an essay on it or whatever? Because if I'm honest, I think that exploring the kind of cascading issues is a good way of kind of being impressive in your response and in your answer. Yeah, because I think like thinking more deeply about these things can help. Okay, cool. Do you guys have any more questions? I'm sorry if I've not been answering them as well as I could be. I know a lot of you guys are sort of at very different stages of your application. And so your questions you might not think is relevant for everyone, but do feel free to ask them anyway. I really don't mind. Everyone can benefit, and a lot of these clips are kind of put up onto our page anyway, so people who can benefit later on are able to come and visit them. Any questions? Also, I'm acutely aware that we're running up to Christmas, so people are starting to wind down in terms of medical prep. I know it will pick up in January, but if you're maybe thinking about like what to do over the holidays for Christmas, and how to prepare. I think in general, if you're in year 13, you've maybe done a few interviews, you're waiting for a few or all of them. If you're thinking about that, I would just carry on preparing. Personally, I think that you should be doing preparations once a week through like now, whether you know you're going to get an interview or not, or whether you've got one or not, you should be doing practice once a week. The best way to do it is to get a group of friends, ideally 2 or 3 friends. Don't go more than that because it just becomes disorganized if you do that. Get a group of three or 4 friends. Every week you all sit down and you essentially grill each other on the very common questions. And then if you get an interview at a specific university, that's when you start to take it up a notch and you start to really focus in on what that university asks. So during these kind of, whilst you're waiting for any offers, you're just thinking about the classic questions like why medicine, why this university, why give me an example of being a good team leader, give me an example of being a good team member, etc. Or tell me a bit about your work experience, that sort of thing. As soon as you get an interview, if for example you get one at UCL, I'm going to talk about UCL because obviously that's what I know most about. You then start to focus very, very hard into the classic questions that UCL like to ask. The best way to find out about that is to Google it, to ask people who go to UCL, and UCL themselves do tell you a lot about what is involved in their interview process. And at UCL, you would really start to focus on your personal statement. You'd really start to focus on your BMAT essay. And these are sort of things that you need to know inside out. So once you know you've got an interview, UCL tell you 2 weeks before, or at least they did for me. You would start to focus in a personal statement. You'd rip it apart. You'd be able to answer you can point to any part of your personal statement and you'd be able to talk about it and answer questions about it. Remember, anything that's in your personal statement is fair game. The interviewers won't ask you, generally they won't ask you very, very scientific clinical questions. But if you've talked about a stent if you talked about witnessing a stent, if you've talked about witnessing a valve replacement or something like that, then do be prepared to answer questions that might go into a bit more detail about those things because you've included them, which kind of gives the impression to interviewers that you know a bit more about this, so it's fair game that they can ask you about that. So do make sure that you do prepare anything on your personal statement is fair game, essentially, and also your BMAT essay. If you haven't already, definitely if you set your BMAT, make sure you write notes on everything that you remember writing about in your essay. Just literally right now, straight after this, we're going to end in 8 minutes. Get a piece of paper, write down everything that you think that you wrote in your essay, and essentially be prepared to summarize. Also, there's a few things you need to be able to do with your BMAT essay. You need to be able to summarize it in one line. That's a common question. You need to be able to say one thing that you might add to your essay if you could rewrite it, or what would you change about the essay if you could change it. I think those are like very 2 common questions that I remember UCL or some of the BMAT universities asking about. So you do want to kind of answer those sorts of questions. Be very prepared to answer questions on the BMAT, like summarizing them, etc. Any good MMI prep resources or books? I bought the. Yeah, I mean, I didn't know there was an MMI specific book, but I know that the ISC have an interview book. That's also on the Super Hub, the Medmentor Super Hub. So do check it out. There's a link there, and yeah, I think a really good resource is to go through that book. The first half of that book is all about the medical school medicine, and about things like the four kind of pillars of I guess ethics, like non-maleficence, beneficence, justice. I can't remember the fourth one now. And things like that. That's really key to know about. That's really impressive because if you know about those kind of the pillars, I think there might just be 3. I'm not sure. If you know about the pillars, the pillars of ethics, then you can pretty much answer any medical question, medical interview question about ethics very, very well. You'll be able to kind of come from different angles, because whenever you get asked about these ethics questions, they're never looking for a straight answer. They're always looking for you to be able to give a very balanced view and be able to show that you're able to think about all the different factors. And a really good way and a really good framework of discussing all the different factors is being able to discuss beneficence, so doing good for your patients, non-maleficence, avoiding harm for your patients, and justice, ensuring that everyone gets a fair kind of fair access to healthcare. So yeah, that's a really good book. That's the first half of the book. It just goes into a lot more detail. It's very good basic knowledge of medicine, so that in the interviews you can answer those sorts of questions. And then the second half is just full of lots of questions that they could ask you. And a really good way of preparing is to go through those questions and essentially write maybe a flashcard for each one and just bullet point your responses. So the first one, I think, is why did you choose medicine? So you might just write a flashcard and you might bullet point your reasons for why you choose medicine, and so on. And yeah, that's a very good way of preparing for your medical school interviews. Yeah. If you guys have joined us now, if you guys want to ask me any questions, feel free. We've got a few minutes to go, so do ask whatever you want. It's also important to remember that when you're preparing for your interview, you will never really have, you will never be able to prepare for every single eventuality, every single question that could ever come up. Trying to do that is just unrealistic. There are certain questions that you definitely need to cover, and we've spoken about them a lot during this session today. The things like why choose medicine, things like why choose this specific university, things like why not apply to be a nurse, why did you choose medicine. These are classic questions that you should generally know the answers to, but in reality there's a lot of questions they could ask you that can just come out of the blue. No way of preparing for them. You can prepare for basically 80 to 90% of questions, but there's 10% that you just won't be able to. And the real skill to be able to answer those well is not to try and do as many questions as you can, but rather just practicing with friends. Because when you get really good at getting asked random questions by friends, you just get really good at answering on the spot and improvising and knowing how to talking and answering these questions. So a really good thing to do is getting friends. If you're not able to do it in school, just create a weekly Zoom with them. Set up a weekly Zoom meeting every like, I don't know, Tuesday evening or Sunday evening, whatever, and just do 1 hour of preparations. Just ask each other, get yourselves outside of the comfort zone, because when the more of that you do, the more in the interviews you kind of like anything that comes at you can answer. Yeah, and just bear in mind that sometimes interviewers know asking a question, they don't really expect you to be able to answer it because they know it's a difficult one. So just remember, don't lie, always be open and honest. That comes across much better. If they do ask you a very, very specific like information related question, you don't know the answer to it, just be honest. Just say, I'm sorry, I don't know. I'll look at this up when after this session. That comes across really well. I think one thing that people don't realize, and they sometimes think that you should know everything to every question, is that a really big part of being a good doctor is knowing when to ask for help, and when to be able to know your limits. As a doctor, not just a medical student, as a doctor, when you're first qualifying, or even later as a foundation year, you will come across lots of scenarios where you do not know the answer to it. You don't know what to do. And that's why you always have some, like the medical registrar on call. That's a sort of senior doctor, not quite a consultant, but a much senior doctor who's available that you can call and ask for help, and who can come and help you. That's why foundation year doctors are able to ask or call the registrar. If they were expected to know everything, then they wouldn't have that system in place. So there are systems in place. They are expecting you to be able to know, actually, this is too far outside of what I know and my limits. I'm going to ask for help now. And that actually shows that you are more competent doctor than someone who wouldn't do that. So again, this is a theme that's been running through this session, but when the more I go through medical school, the more I do medicine, the more I realize that every single thing that they do at interview is basically reflected upon in the medical kind of field. The things that they ask you about, the things they get you to do at interviews, and the things they want you to talk about in your personal statements are things that they know that you will have to do in some sort of way during medical school. And there is a lot of parallels, and that's why it's really easy to know how if you know how you're supposed to do it as a medical student and as a doctor, if you know how to break bad news, and there are websites online that you can go and search on how you could break bad news, for example, that's actually a really good resource for when you're preparing for the acting station that you might end up doing in an MMI, when you're trying to break bad news to a customer. It's the same skills, and being able to do that is actually a very good way of preparing. So if you guys, last questions, because it's 7 o'clock, but I'll take one more question if you guys have it. If not, then it was very nice doing this session. I know that Tafsir has left kind of big boots to fill, but I hope you guys have still benefited from me. He's definitely much more qualified and superior than I am at answering these questions. He's been doing this pretty much since he came to medical school, and helping people with their applications and giving advice. But if you guys have any questions, send them now. I'll wait one more minute. Otherwise, thank you very much. I'm just letting you guys type. Okay, so I don't think there looks like there's any more questions. Thank you all for joining. As you know, every week we have. So first of all, if you guys have any feedback for me, just drop it now in the comments. Feedback for Medmentor. If you've just joined us, it'd be great for you guys to let us know what you think about the website, what you think that we could be doing that we're not doing, what more you want to see. And yeah, as you know, every week we're always here at 6 p.m. It's 99% of the time will be Tafsir, but if it's not Tafsir, it most likely will be me. So if you have any questions, do feel free to come down on Saturday, 6 p.m. Any questions that you have during the week, just write them down on a piece of paper. Anything that difficult you've come across, you're not sure about how to do it, write it down on a piece of paper and bring that piece of paper with you for Saturday for 6 p.m. because at 6 p.m. you're going to have Tafsir or I answer your questions and help you out. You can just literally read them out or write them out for us, and we'll be able to go through them one by one. Tafsir, like I say, he's university UCL interviewer. He has been for the past 2 years. He's also one of the leads for the UCL outreach program, the official outreach program, which is endorsed by the university. So he has plenty of experience. He's done that for almost 6 years now, pretty much throughout the medical school. So he's the perfect person to answer these questions. He's done this tons of times. He's very qualified. So yeah, bring your questions. And thank you very much, everyone. Thanks for joining me. And that's the end of the session.